know that Black communities have faced health inequities across disease areas for generations, leading to worse health outcomes. But with HIV, there's that extra layer of stigma. What role do you think stigma is playing in driving the epidemic in Black communities, and what can be done about it?
Oh gosh, I mean, stigma just doesn't sit along HIV. It actively fuels it. And in Black communities, particularly where you've got structural racism, misinformation, you've got cultural silence around sexual health that exists already. Stigma really creates that perfect storm, and it prevents open conversations, it delays testing, discourages treatment. But for me also, particularly, it's the isolation for those living with HIV and being forced to live in this duality, where they know they're living with a condition, but they can't actively share it and get the support that they need. And I think that people fear judgment from their families and communities, and sadly, often from healthcare professionals as well. For me, I think it's about addressing both societal attitudes, but also internalized stigma as well, because you're living in society and impacted by it, sorry, and that gets internalized. So I really feel it's the thing that we emphasize again and again, but we haven't quite gotten to, truly culturally tailored education, visible role models that are empowered and supported, and also safe spaces where people can speak without fear. Denis mentioned about migrants and the vulnerabilities. And for migrants, there is that added layer of, can I speak in openness here? Because they're concerned about what could happen to their status. So I think we've got to equally hold systems accountable, though, healthcare, media, policy, to really challenge the narratives that perpetuates stigma. It's a collective responsibility.